Welcome to Innovate Training. My name is Carol Peugeot, and I'm your instructor for this course. This course is titled Understanding HIPAA for the Medical Office, and this lesson is called Busting HIPAA's Myths. So what are we going to talk about today? Well, first of all, we're going to dispel some common myths related to HIPAA. We're going to talk about the way some untruths have actually affected the way some medical practices have been operating. We're going to explain how HIPAA affects how appointments are scheduled, and then we're going to discuss HIPAA rules concerning communication with family members and with clergy. Well, since HIPAA has been introduced, there have been many myths regarding the HIPAA rules. One of the most common mistakes regarding this law is the misspelling of the acronym HIPAA, spelled as HIPPA. This error is so common that it is found in legal documentation, professional flyers, and academic journals. HIPAA, if understood in proper context, is not as complicated and enormous as first thought. So let's talk about one really big HIPAA myth, and that's the appointment reminders. Appointment reminders are either phone calls or some type of correspondence mailed to the patient's house that reminds the patient either to make an appointment or that they have an appointment set. Well, to protect patients' privacy, many healthcare professionals were reluctant to leave voicemails regarding patients' appointment reminder. Some practices have even stopped sending out recall reminder cards, thinking that if they were seen by another household member, the patient's privacy would be violated. What is a recall reminder? A recall reminder is a postcard or other type of correspondence that's sent to the patient's house, and usually what it is a reminder that the patient needs to call to make an appointment. Recall reminders are very common with types of professionals that see patients on a routine basis, such as a dental office or optometrist, or maybe even the general practitioner who needs to see the patient at least once a year for a physical. So these are common with the types of physicians where you would see them on a routine basis, but not on a very frequent basis. Another HIPAA myth has to do with prescription pickups. Many family members were afraid that only the patient would be able to pick up prescriptions at the local pharmacy. Well, in response to this, this isn't always feasible for a patient to be able to pick up a prescription. They may be too sick or infirm to be able to come to the pharmacy, and the pharmacy understands this. Well, while the pharmacist may not hand over prescriptions to anyone who walks up, some patients are unable to come to the pharmacy, so they allow for a family member or other caretaker to pick up prescriptions for them. Well, under HIPAA, a family member may act on the behalf of a patient when it comes to prescription pickup or other types of health care. Another HIPAA myth is the discussing patient information. A hospital or physician cannot share any information with patient's family without the written consent. Well, in response to this, the privacy rule permits a healthcare worker to disclose to a family member or close relation the patient's medical condition. If the family member is present while the physician is discussing the care with the patient, the permission is implied, so therefore the physician will not have a problem discussing the patient's condition with the family member or with the other person who is concerned. So therefore, this is actually a myth. Another HIPAA myth is the refusal to sign notice of privacy practice. Should a physician refuse to provide care if the patient refuses to sign this notice? Well, in response to this myth, the privacy rule requires that the providers make a good faith effort to receive acknowledgement of this notice. If a patient refuses to sign, a refusal to sign notice should be in the patient's record. The signature of the acknowledgement is not consent for treatment, nor is it authorization to release records. Now, what is a notice of privacy practice? Well, every practice should have a written notice concerning their procedures to retain the patient's privacy or protect the patient's privacy. And this is usually signed when the patient first registers as a patient, and then this signature is kept in the patient's file. Well, as we mentioned, because some patients may refuse to sign this, it doesn't mean that the physician cannot treat the patient. It only means that they have refused to accept this refusal to this notice of privacy practice. So therefore, in the patient's record should be some type of notation or some type of note by the provider saying that the patient has refused to sign. Another HIPAA myth has to do with the hospital's patient list, and that the fact that HIPAA has now eliminated these. And what this is if you have a loved one or a friend who's in the hospital, in the past you would have been able to call up and ask how this person is doing or the status of this person. Are they still in intensive care? Are they improving? Or have they been discharged yet? Well, many people believe that they can no longer find out the status of a friend who has been hospitalized. Well, in response to this, the hospital list response, the privacy rule permits hospitals to maintain a published listing of patients unless the patient has chosen to opt out. And what it means to opt out is when the patient registers, they have a choice to be not listed on this list. And therefore, if anybody calls inquiring about them, that information cannot be given. But this is only if they have chosen to opt out. The information that is disclosed, it's limited to, in other words, it's the minimum necessary, it's limited to their room and bed number, their condition stated in general terms, such as, he's doing better today, or she's in fair condition, or the surgery went well. They cannot give more specific information than that. Another myth, and this is a big one, sharing of patient information between doctors. Many providers assume that nothing could be shared with a consulting physician without permission. Well, in response to this, the privacy rule permits providers who are involved in the direct treatment of the patient to share freely protected health information without further authorization. Now, you got to remember the privacy rule and what its intent is and what its intent is not. Remember, we talked about this. Without the ability to discuss services and treatment, patient care would be greatly impaired. The physicians would not be able to effectively treat the patient if they could not communicate between themselves. So therefore, this does not fall under the privacy rule. Another HIPAA myth has to do with the members of the clergy being denied hospital information. Many feel that clergy members would not be able to have a list of patients who may be members of their religious denominations. Well, in response to this, the patients may be included on a denominational list of patients. Only clergy may then request a list of patients under their own denomination. The patient has a choice, of course, to opt out of this list. Any policy more restrictive than this is an internal hospital policy and will take priority, of course. Our final myth has to do with faxing of health information and that it's prohibited. Fax machines have been widely used to send health information between providers. With the HIPAA privacy rule, the possible disclosure of protected health information to unauthorized persons is punishable by law. Many facilities refuse to send any information by means of fax machine. Well, in response to this, fax machines have made life a lot easier and afford for quick access to medical information. However, there are some guidelines that have to be set into place when using a fax machine. For instance, the machine must be located in a secure location away from unauthorized access. There must be an audit trail or record must be kept to document that information was sent to the proper location and that they have received it. A cover sheet with a disclaimer that this fax is intended for the designated person should only be used. The best protection is to call the receiving party to confirm receipt of the information. And then don't forget to log that phone call in the patient's record. Well, in summary, because HIPAA was such an important legislation written by the government, myths and exaggerations are sure to make their way through the internet and into medical offices. Sorting out the truths from the myths helps providers to provide better HIPAA compliance and will make your job much easier. Well, I'm glad you've joined us for this lecture, Busting HIPAA's Myths. Please contact me with any questions or comments. You can email me at innovatetraining@gmail.com. I would love to hear from my students. Please be sure to take the assessment after this lecture. These assessment questions will help you in preparing for the HIPAA final exam, which will be in the next lesson. So please be sure to also take the review lecture slides and go over those, and then take the HIPAA final exam. You could take the HIPAA final exam as many times as you need to, and if you have any questions, concerns, or comments, please let me know. So for Innovate Training, this is Carol Peugeot, and thank you for joining us. Bye.